About 10 people are sick right now. We have to drink water from the stream.
We just don't have enough medicine even for common colds.
Manipur was supposed to be a place of safety for thousands of people who fled from conflict in Myanmar. But ethnic violence, which broke out in the Indian state in May, has affected their freedom of movement and ability to access healthcare, and they have not been warmly welcomed. Hello and welcome to Doh Athan, a weekly podcast about human rights stories from Myanmar. It's brought to you by Fondation Hirondelle. This episode is produced by journalists from Frontier Myanmar. Names and voices may have been changed to protect contributors.
Right now, I'm in More. I came back to fetch rice, blankets and clothes because I'm running low on things like rice and others. It's already past curfew in More.
Daw May is in the house she and her family have rented for the past 18 months in the Indian border town of More. It's after 2 p.m. and since 1st of November that's been curfew time. She's waiting for a delivery before she can go back to the village where her husband and sons are hiding out.
It was safer for me as a woman to come back. In More, it's mainly men who need to worry because they are the ones getting arrested.
Daw May and her family are from Tamu Township in Sagaing region. They fled across the border into the Indian state of Manipur in March 2022 after one of their sons, a PDF member, was badly injured when testing a homemade gun. They got him to a hospital in the state capital, Imphal. He spent a month there while the rest of the family settled in More. He had a follow-up appointment later that year, but he still needs more extensive care, as his father, Doh Athan, explains.
We need to get a prosthetic leg for him. A big metal plate was implanted in his leg. The metal implant must be removed, they said. After that, a jawbone surgery needs to be performed. I don't know how it will be done, but it's a must.
But in May this year, their lives became much more complicated as ethnic conflict broke out between the Meitei majority and the Kuki minority in Manipur. Over 180 people are reported to have been killed. Checkpoints were set up and a 6 p.m. curfew was imposed. Most Myanmar refugees are not in India legally, so many Burmese avoided going out at all in case they were stopped on the streets. They were also treated with suspicion by the Meitei majority because many people from Tamu have family or ethnic connections with the Kuki. Daw May's son couldn't travel to Imphal to get the follow-up treatment needed. Doh Athan couldn't work, so he couldn't support the family, and Daw May couldn't get medicine for her chronic stomach ailment. Local hospitals and clinics were closed. There was one clinic run by Myanmar medics who had joined the civil disobedience movement. But donations have decreased, so medicine stocks were also low. And due to the heightened security, they can't transport serious cases to better equipped hospitals further away. Go Swa is one of the health workers there.
We just don't have enough medicine even for common colds. We check their illnesses. We explain things to them carefully. When we had medicine, we gave it for free. Now, we don't have any, so we just write them a prescription and tell them to buy the medicine just across the street. We feel bad.
Then on the 1st of November, things got even worse. An Indian policeman was shot dead in More, and authorities reacted by arresting dozens of what they called illegal immigrants from Myanmar. Most Burmese living in More fled to more remote villages where they might not be found. Daw May and her family were among them.
It was quite a journey. It took us about 4 to 5 hours. We walked all the way. I was feeling unwell and had to take many breaks on the way. My stomach was better, but I had a runny nose and a cough, so I didn't have much stamina. My family had to wait for me. After walking up the mountain slope for 5 steps, I would get tired and needed to rest. The smuggler's trail we took was very narrow and winding along a steep cliff.
Several weeks later, most of the Moray Myanmar refugees are still scattered in these villages. They don't feel it's safe enough to return to Moray yet. Daw May just made that one quick home visit to pick up more provisions. Joshua, the CDM medic, also fled Moray. He's now trying to reach the refugees in various villages to provide some kind of medical help. And there's even more need than before. People fled without taking many clothes or blankets. It's wintertime right now, so it's cold in those hills. And Daw May says the facilities in and around the villages are basic.
About 10 people are sick right now. We have to drink water from the stream. There are not many wells around. Some people get diarrhea. Some are coughing and sneezing.
The family is also struggling to get enough food to survive. And it's not always food that agrees with Daw May's stomach. But it's the health situation that Doh Athan is most worried about.
If we don't have food for today, we can just go to a friend's house and share their food. But if it comes to health issues, friends won't be able to help me. If the CDM clinic can't give us medical treatment, where can we go and get treatment? We just have to die.
A Myanmar civil society organisation, or CSO, now helping refugees in India, estimates that about 70,000 people from Myanmar fled to India for their safety after the military coup. There's no exact record, but one of the CSO's spokespeople in India estimated that there are 60,000 Myanmar refugees in Mizoram in India and about 5,000 in Manipur. While both the people and local government in Mizoram have been quite welcoming, it's been a different story in Manipur, particularly after the ethnic violence in May. The spokesperson is calling for more help for these refugees.
What I want to say is that the Indian government should recognise all the people who are in the country due to the Burmese coup and give them the help that they need. There are no arrests in Mizoram. There are some arrests in Manipur, where many people fled from the conflict in Sagaing region. The main thing is that the state government has not recognised them, so authorities arrest refugees.
For now, these refugees are having to help each other in the hills of Manipur. Daw May hopes that the situation calms down in Moray soon, in which case they might go back. But it's not a long-term solution. What she really wants is to go back home, to Sagaing. But the risk is too high.
I've heard about children being taken as porters in Galay and Tamu. Most of my family members are male and my daughter is quite young. We would be afraid to go anywhere. I hope the revolution succeeds quickly because I want to go back to my own home. It's difficult living as a refugee in a foreign country.
Thanks for listening to this edition of Doh Athan. We'd welcome your feedback on social media. This project on human rights reporting is supported by Fondation Hirondelle with the help of our donors. You can listen to our podcast via the Doh Athan Facebook page. They can also be found on SoundCloud, YouTube, iTunes and Spotify. You can also listen every Saturday night from 9 to 10 p.m. and Sunday morning from 6 to 7 a.m. on Voice of America Radio. Please tune in again next week.